Joining me now is Dr. Jessica Gold, assistant professor in the Department of Psychiatry at Washington University in St. Louis.
Dr. Jessi Gold is a mental health expert.
And Washington University assistant professor of psychiatry, Dr. Jessi Gold.
Joining me now to talk about this is Dr. Jessica Gold. She's a practicing psychiatrist.
And that expert is here with us. That is Dr. Jessi Gold. She is an assistant professor of psychiatry at the Washington University in St. Louis School of Medicine. How are you doing today, Dr. Gold?
I see healthcare workers from the people who greet people in the hospital, the people who clean the hospital, to like a person who's an administrator in the hospital. And everybody's really been struggling. So the first thing we need to do is allow ourselves to feel, give ourselves space to feel, talk to our friends and family if we can. If that's not someone we feel comfortable talking to, reach out for help. There's help that exists. There's help for people like me, and we want to help you. And I think that's not something we're used to doing. We're used to putting the mask on other people and really, really focusing on helping others before we help ourselves. And we really need to do both right now. And that's hard to do, especially when the day-to-day is filled with so much adrenaline that we can't stop and focus on ourselves at all. And we need to do both to be able to keep going and to want to keep going.
What do you say? You say feelings are normal, that there are no wrong feelings, that this is a really hard thing for everyone, that anything you could possibly be feeling, from sadness to anger, from anxiety to fear, is normal. And if you feel it, you are completely entitled to that feeling. We really have to give ourselves a little bit of a break, and we have to say, this is hard. We're all learning together. And I think that's the first thing we have to do. Then we have to learn to live with uncertainty a little, and none of us like that.
One of the symptoms of trauma is avoidance. So you really don't want to go back to the place that caused the trauma, and their work is the place that caused the trauma. So I think it's going to be really hard for them to go back to work.
The data might be used against us in some way, and it's just very confusing. And so this lore gets passed down where people just go, I'd rather just not get treatment. And that's why a lot of the time it ends up being a crisis or nobody tells anyone, right? And so it's a really dangerous situation.
How do I pull myself out of this crippling depression? You're talking to someone who's got the world on her shoulders right now. Dr. Gold, what do you say to Anita?
Thank you. So that's the first thing I would say. So you probably don't hear that enough, even though maybe someone said that to you, but I'm saying it now, so thank you. I think that, you're doing a lot and probably underappreciated for most of those roles, because caregiving is an underappreciated role, frontline work is an underappreciated role, and so they probably just compound. I think that what you're describing sounds really, really hard, and I actually would hope that you seek help if you need it. We need to be able to say this stuff out loud. Suicide doesn't need to be a dirty word. It needs to be something that we say out loud, that we talk about, that we ask for help when we need it. We have treatments. We have ways to help it.
All right, Dr. Jessica Gold, thank you for joining us.
Dr. Jessi Gold, assistant professor of psychiatry, Washington University in St. Louis School of Medicine. I can't thank you enough for being here and taking all of these questions. We're so grateful.